Hello, everyone. I'm Garrett Chumbley, Vice President of Business Development for CEC. I'm coming to you from my home, and we have with us Meg Nugent, which is coming to you from our office in Des Moines. We want to thank our production team of Sharissa Byers, Angie Worrell, Randy Montelius, and Chris Wood. Without them, we are unable to put this together. Today's presentation will be around 20 to 30 minutes, probably closer to the 20-minute side. And if you have any questions, please submit those to the Q&A function of your Zoom call today. At the end of the presentation, I will splash up both Meg and my contact information. So if there's any questions that you don't want to submit to the Q&A or you would like us to follow up on, please submit those through that channel. So today we're being joined by Meg Nugent. Like I said, she's been with CEC for around 2 years and mainly has a background in the clinical experience as well as the leadership side. So Meg, I was wondering if you could introduce yourself a little further and kind of give us some more details on your background.
Sure, thanks Garrett. Hello everyone. Yes, I am a nurse by background, and I find that just really helpful and awesome to be back working in hospitals and working with clinical staff. My clinical background includes emergency department, critical care, procedural areas, as well as general nursing and long-term care, which again, I think really adds a lot of value to this role. And I'm able to work directly with clinicians and understand where they're coming from when it comes to nurse call. And then also from an administrative and leadership perspective, I have worked in various roles, including hospital administration, clinic administration, corporate clinical outcomes, and also a lot of federal and state contracting, which gives me really a broad view of what hospitals' needs are, as well as really tackling their quality and patient safety goals when we bring in a new nurse call system, which is really crazy because nurse call, as many of you know, used to always be a doorbell and a light above a room, and now with it being so sophisticated and driven by servers and databases and really programmed with a programmer, we can do a lot of cool things to augment patient safety and clinical quality outcomes in our healthcare facilities. So that was kind of long-winded about me, but also—
Hey, that's all right. I think, you have a really diverse background, so it's good to hear, where you can bring value. And I think, just so you guys know, me and Meg, we had offices right next to each other. So we got to know each other pretty well over the last couple of years before the lockdown took place, and I went to remote. So for that reason, I feel more comfortable showing you what I'm going to show you next, which is really in honor of our graduates that are taking place in 2020. I have a son that's graduating high school, and Meg has some children that are either graduating college. Is that right, Meg?
Graduating from college, yeah.
Oh, nice. Very nice. So for that reason, I am going to honor them with a nice picture of Meg during her high school graduation. Now, this was in the 90s, and, my wife said I couldn't bring up the year. So we'll just say the 90s, and we'll keep it at that, because I think I don't want to get in trouble by Meg or my wife. So I think, I love your hair there, and I think this brings back memories of the Aquanet. And yes. I always thought it was interesting that once they stopped producing Aquanet, our ozone started to repair.
Well, I was going to say, wow, the hair, you can tell what year it is probably by the hair. Well, interestingly enough, if I would turn like this, the bangs would be up, and that hat would still fit flat on my head. It's not squishing any hair. It's just the bangs are up. So
that is a great picture, and thanks for being a good sport and let me to share that during our graduation season. All right, so you ready to dive into our topic today, Meg?
Yeah, let's do it.
All right, like the first slide said, we're going to be talking about implications of nurse call during the COVID-19 pandemic. So my first question is, what are some of the short-term recommendations that CEC has to utilize nurse call during this period of time?
Really, as I said earlier, it's such a dynamic system that we are a distributor for the Rauland product, which in our acute care facilities is the Responder 5 that we are implementing now. But it's such a dynamic technology that we really have lots of opportunities to utilize the nurse call system to limit risk and make life more efficient for our clinical staff. So, there's a lot we can go through, but just, starting off really focusing in on how we can make life more productive for clinicians. They're under a lot of stress right now and a lot of unknowns. Some facilities are, they don't have a whole lot of patients because we don't have as many COVID patients here in some areas of Iowa. But so just anything we can do to help them during this time is what I'm looking to do with our system.
So what type of changes can be made to our nurse call to limit the exposure of the staff to the COVID?
Good question. There's a couple different areas that we can look at. One is, first off, that comes to mind is programming. And how can we get in the background on the database, make changes to the configuration to really enhance how the system is used. So the first thing that comes to mind is limiting staff exposure to COVID. So we want to keep the staff outside of the room as much as possible, but allow them to be able to still communicate with their patients. So one way to do that would be utilizing the nurse console to dial directly into the patient's room and have a conversation. It doesn't have to be initiated by a patient call. You can just pick up that nurse console and dial right into the room and talk to them. Another way is to allow calls to be canceled by the nurse console pickup or by a mobile phone pickup instead of having to go inside the patient room and manually press the cancel button. So those are a couple of easy ways that we could change programming and really reduce the staff exposure and also reduce PPE. So hopefully reduce some costs to the facility because people aren't having to gown up, mask up, glove up to go into a room when they can just talk to the patient outside the room.
Yeah, and I would imagine that'd be a huge sign of relief from them if they didn't, if they could actually take that mask off for a little bit. I've seen some pictures as we've all seen on the news, and they're really definitely on the front lines and doing a phenomenal job.
Oh my gosh, yeah. I mean, now you walk into a Casey's or a gas station of some sort, and people are wearing them, and even that staff. I mean, just having the mask on all the time. One, it's brings claustrophobia to people. It's hot. You're breathing in your own CO2. There's just a lot going on there. So yes, if we can reduce that for our clinical staff, I mean, they've got intense time of wearing a lot of PPE. So any reduction we can do is well worth it. Another thing we could do is use the 1/4-inch jack, either on a patient station or a 2 or a 4 jack station. We could program that for auxiliary medical equipment. So for instance, maybe you're going to now make a single room into a dual room and you need 2 nurse call buttons for the patients to utilize. So you could plug in an alternate call device for another patient and make it there, voila, you have 2 call jacks for the patients to put on a call light. Or it could be used for something like a vent where you wouldn't normally have a vent in a room and you need to hear the alarms, but the doors are shut and the patient's behind the door. So maybe you want to plug the 1/4-inch jack from the vent in to send alarm messages outside of the room. So those are great things that we could do along with use of the staff terminal. That's a really dynamic device. Not every hospital has it, but a lot do, and it's inside the room. But it would bring the provider in the room, but we could use it for things to program for intubation. So intubation start, intubation stop. Maybe we don't want a whole lot of people in the room when we're intubating because of the droplets and that sort of thing. So that could be a function of that, or we could create a timer. So maybe you only want your staff in there, get in, get out for a limited amount of time, and you want to track that. You could set a timer, and then it would alert them that they've been in there for 10 minutes or 15 minutes. So good reminders for staff.
Yeah, that's a great reminder. With your background, we wouldn't be doing it justice if we didn't talk about the clinical side. So from your clinical background, what are some of the recommendations that you would have to enhance the Rauland system?
Well, I am really lucky to be supported by Rauland as a clinical application specialist with CEC. I interact with clinicians all over the United States, and especially during this pandemic, we have gotten some awesome ideas coming forth from people that have stood up hospitals overnight. We've had people in New York that just incredible experiences, but nurse call is always needed. And so they've just come up with some great ideas from a clinical perspective in utilizing the system. And one goes back to the staff terminals and creating a new alert. I need to look at this so I get it right, but it is the Merit Alert Medical Emergency Response Intubation Team. So they've put that and COVID units on the staff terminals if they already exist, and you're able to hit that button and it will page or call on the mobile to the team for rapid intubation. A lot of these patients we've seen are going downhill fast, and intubation is necessary very quickly. And so to be able to send out an alert that is just pertaining to that everyone knows it's related to a COVID patient, that we need to rapidly respond with equipment, but also keep minimal personnel in the room so we limit exposure. So that is just a great tool that could be used. Also, I've seen in ORs, again, where you're doing the intubation and then our intubation now, and then now we're done with intubation so more staff can come to the room. We're using lights outside that tie to that staff terminal to alert people about what's going on in the room. So just at the glance, you can see what is happening in the room by the colors of the corridor light. And that also goes for just indicating that it is a COVID patient in the room. So maybe you want a status light on all the time, similar to fall risk or DNR, something like that, where we light all 4 segments of the corridor light to indicate a status. So that could be COVID, some kind of color combination to indicate COVID in that facility.
Oh, great answer. I think when we look at our personal lives through this whole period, and I think everybody's had a chance to reflect on some of the pros and some of the cons, and there are some long-term effects that I've seen that we're going to carry on personally, whether it's game night or being more fit, doing things more of a family. So I think there's more of those that could actually take place in our technology world. So what are some of the long-term effects that you could see that are going to expand past this COVID-19 era?
And you don't have the COVID-19 because I pretty much ate my way through this time at home. So not
the COVID-19, I've never heard that.
Like freshman 15, now I've got the COVID-19. So no, all kidding aside, I think, one big thing for healthcare facilities, especially in Iowa and Wisconsin, where we have rural facilities, they may be the epicenter of care for their county or just for their geographic area. They always have to be prepared for something, for some type of emergency. And emergency preparedness has gone hand in hand with hospitals forever. But I think now pandemic preparedness is going to be included in that. And in my lifetime, I've never really had to deal with it. I think years and years ago, a new pandemic came almost annually because we were learning how to develop vaccines and medications to address them. So I think now pandemic preparedness is going to go hand in hand in that, with things like I've already mentioned, use of the staff terminal to provide indication of what's going on in the room. We can program those easily to change it, or it may just be a button that's always there. The intubation techniques have changed a little bit with COVID. And so utilizing the staff terminal for that, I think too, infection control, we all learned the value in that and reducing exposure. And patients really are learning how to adjust to, maybe not having their nurse readily to be in the room with them, but talking to them just like they would on FaceTime or on a cell phone, they're learning how to deal with that when being sick and trying to work with their healthcare providers. So I think some of those things may be emergency planning where we just see them erupt when needed, but some may stay constant for us.
So what are some other options as we're seeing the need to expand some of these facilities or even to build up a new unit setup altogether? What are some of our options when it comes to that category?
Well, if it's a unit that's currently R5 and they have the jacks, like I mentioned earlier, the 1/4-inch jacks, we can manipulate those with programming and external devices to stand up an additional bed in a room. So going from a single patient room to a dual patient room, that would be fairly easily done and not cost prohibitive, or, it would just be adding another device that we probably already have and then some programming. Additionally, Rauland has rapid response kits, and they have them for both acute care and long-term care. So long-term care, our system is the R5K or the R5000, and then R5 is our acute care devicing. And so they do have available rapid response kit that is portable. You stand it up, you are able to elicit a patient call, an emergency call, and also communicate to the patient through a speaker, just like the patient station on the wall. Within 24 hours, you would have that set up. So that is a really great offering, especially I know that my colleagues in New York and New Jersey have had to utilize something like that to stand up a system rapidly within 2 or 3 days, an entire hospital. So there are ways to do that. It would be probably easier if you already have an existing system to go ahead and do that quickly, but we do have ways around that just to add. Say you want to convert a wing, that's right now is just dead space or conference room space, and now you want to add patient rooms, that can be done easily. And then also, so if you're going to use the system differently, so say you're going to you have a PACU, which you might have a patient station for a patient call. You might just have some buttons on the wall. A lot of programming tricks up our sleeves to help convert those to patient rooms as well.
Well, just speaking of your colleagues that you brought up just a second ago, I think this is a good time to talk just a brief moment about the nurses and what are you hearing on the front lines from these people that are finally now getting some recognition of how tough their job is. And I think if, as you've seen in our first slide that we showed up, it showed a nurse in a Superman's cape. And I think many people feel that way about nurses now. And so I just want to hear what some of your feedback is from those nurses.
They're humble, Garrett. I mean, they're just doing their job. And I'll say they're tired, scared. The effects of the pandemic at end of life are incredible. And the stories I've heard are something, I mean, I haven't witnessed it because I'm not in clinical at the bedside now, but I am able to connect with clinicians regularly, and I don't think they feel like Superman or Superwoman. From popularity standpoint, or that people are recognizing them, recognition standpoint, but they do just really care for their patients, and this has been tough. It's been really tough on people.
Well, excellent. And to finish our conversation today, I wouldn't mind just talking a little bit about you again. You are my guest today. So what is one of those projects that's taken place over the last few years that you just felt exceptionally proud of, that was a big win, and you'd like to share that today?
Well, I'm going to say that there's no project that comes to mind really, except for the ability to really work with every hospital individually and each unit individually, so that, how do I say this? So all the workarounds that nurses have that people, say that's the they just do it that way because it works better, but nobody really recognizes it. I love R5. I love the Responder product and the nurse call flexibility and customizability. Is that a word? To be able to really hone in on maybe those things that just frustrate a nurse or the NA or the unit clerk, and really make them reality and drive them through the nurse call system so that we can use technology to really improve process and workflow. I get to do that every day or almost every day. And I just really love that and so proud of that. And I feel like they're really proud of it when it all comes together at the end and they're able to utilize the product to do something that they've been trying to do for a long time. So I think from an efficiency and a risk reduction standpoint, that's really important for hospitals and healthcare facilities.
Well, excellent. And we want to thank you for your time today, Meg. It was a great level of information. And so just to wrap it up here, I'm going to throw this picture back up because, I mean, why wouldn't I, right? So as this year's graduations is coming around, feel free to pull out some of those old photos and share with your graduate students or even your younger kids, because, you know, everybody likes to have a good laugh. And I know mine, you have the hair, I had an extra 20 pounds hanging, but we won't go there. So the second key theme is big hair will probably make a comeback. After seeing this picture, I don't see why it wouldn't.
Well, it's something. I don't know if we have the product to do that now.
No, I don't think they banned Aquanet, I think, in 7 countries. So Meg's background, you're truly amazing, and I think you're so helpful for a lot of our customers. So even if you're out there and you don't have the Rauland product, feel free to engage us. And I'm going to get this picture off so Meg doesn't shoot me later. Feel free to engage us, and there's our contact information that I promised at the beginning of the discussion. And if you don't want to reach out to us directly, feel free to go to our website at cecinfo.com. And finally, the solutions we discussed today are ways to truly improve your organizational, at a high level. It helps reduce risk, improve operating efficiency, as well as improving your experiences for your patients, your customers, your visitors, as well as your employees. So again, thanks to our production team and you, the audience, for participating. Always thank you, Meg, for joining today and making this successful. This concludes our discussion for today. So from our homes and Meg's office to yours, and from everyone at CEC, we thank you.